Good morning. Today we will discuss about the nursing process. That is a very important topic in the fundamental of nursing. Nursing process is a critical clinical process that professionally nurse use to apply the best available evidence to caregiving and promoting the human function and response to health and illness. According to American Health Association, nursing process is the mean of that we systematically method of providing the care to the clients. So that is a systematic method, so method of planning and providing individual nursing care to the patient. What is the purpose of the nursing process? To identify the client health status and actual and potential health problems or needs. Second purpose of the nursing process is to establish the plan to meet the identified needs of the patient. Third one, to deliver the specific nursing interventions to meet those needs. These are the purposes of nursing process, so that we provide a good and effective care to the patient. In nursing process, we follow the 5 steps that is called ADP. A is used for assessment. D is for planning. D is for diagnosis. P for planning. I is for implementation, and E is for evaluation. You cannot provide nursing care without following this process. We cannot jump without doing the assessment. We cannot do the diagnosis without knowing the diagnosis. We cannot do the planning. So we have to follow the ADP, and it is very important when we give the nursing care to the patient. So these are the nursing process steps. First one is the assessment, second one is the nursing process, third one is the planning, fourth one is the implementation, last one is the evaluation. Assessment. In assessment is the systematically and continuous collection and organization, validate and documentation of data. Assessment, what we do the systematically and continuously collect the data about the patient. About the patient, so that we know about the health condition of the patient. So there are 4 types of assessment we do, like initial nursing assessment, problem focus assessment, emergency assessment, and time lapse assessment. We will discuss it one by one. Initial nursing assessment is the meaning that when the patient came to person to us, then we check the health condition of the patient, check the vital signs of the patient for future needs. So we do an initial nursing assessment. Second one is the problem focus assessment. In this, we only focus on the specific problem. For example, a patient said that I'm suffering with the chest pain. You only focus on the chest pain. You say like ask the question, uh, um, location of the pain, how the intensity. If I ask you on the scale of 0 to 10, where you give a grade to your pain. So we only focus on the chest pain. Third one is emergency assessment. During emergency situation, to identify any health life-threatening situation. For example, you are working in your area, like in area, and suddenly a patient crashed. Then you do not check the vital signs of the patient. What you will do, check the carotid pulse of the pulse and ask the patient, are you okay or not? So we do a rapid assessment. Check the ABC, airway breathing and circulation of the patient to know if the patient is a cardiac arrest or not. Last one is the time lapse assessment. Time lapse assessment is the several months after initial assessment to compare the client current health status with the data previously obtained. In this, what we will do, we do the reassess the patient from the previous assessment to know the condition of the health of the patient. He is worsening the condition, worsening the patient, sign and symptom of the patient, or he is getting fine. There are 2 types of data we use in the nursing in the assessment phase. There are subjective data, and second one is the objective data. Subjective data is also called the symptoms or covert data, are clear only to the person affected and can be described only by the person. Subjective data is the data which is explained by the patient. For example, patient said that I have a chest pain from 2 days, and I have a itching. I feel breathlessness. So these are the subjective data. Objective data are the signs which are measured by the observer. We Observer are nurses, doctors, anyone can be the observer. They can be seen, heard, felt, or smelled, or they can obtain by observation of physical examination. For example, objective data we can take by checking the vital signs of the patient, by doing the physical assessment of the patient, by doing the inspection, auscultation, palpitation, and percussion. We do the assessment. Okay, here is the golden nclex rule for all of you. You always assess before you intervene, unless it is a life-threatening emergency. For example, if a patient say, "I feel shortness of breath," your action is not immediately give the oxygen to the patient. What you have to do first, check the airway breathing and circulation and lung sounds. Only after that, you decide what we have to. That is the main purpose of the nursing process. Okay, in this, what we have to do, first of all, we assess the condition of the patient, because this is the data which is the subjective data. Patient say that I have a shortness of breath. I have a shortness of breath. What we will do, we check the objective data. We check the vital signs of the patient. We check the airway of the patient. So after that, we will do what we have to do. Okay. There are lots of source of data we collect, primary and secondary. Primary is the direct source of the information. In this, we get the data from the patient. Secondary, we take the information from the family member, from the previous report. So there are different type of data we collect. Method. Next, we discuss about the method of data collection. There are a lot of methods of data collection. First one, the observation interview. It is a gathering the data by using the sense, smell, and hearing. Observation, we observe the patient only by checking the by checking or by the facial expression of the patient. We observe the patient. We get the data. Interview, by doing the face-to-face communication with the patient. We take the data. So these are the types of the method of data collection. Till now, we will discuss about the assessment phase and diagnosis. In assessment we discuss about the we do the assessment, and next we will discuss about the diagnosis. Diagnosis is the second phase of the nursing process. In this, the nurse use the critical thinking skills to interpret the assessment data to identify the client problem. That is a nursing diagnosis differ from the medical diagnosis. Medical diagnosis the condition of the patient. Nursing diagnosis according to the sign and symptom of the patient and what the patient feels. According to that, we make the nursing diagnosis. So which diagnosis is the diagnosis? The nursing diagnosis. Next step we use the ADP. Second one we use the D for diagnosis. The next one is the P. P for plan. In planning, what we do involve the decision making and problem solving. It is the process in which what the nurse we do, what do that is a to nursing intervention required to prevent and reduce or elimination of the health problem. For example, a patient said that I have a chest pain. What I will do, I will make a planning that I will check the vital signs of the patient. I check the location of the pain, ask the question from the patient, where you feel the pain, uh, can you rate me the pain on your rating scale, okay, and give comfortable position to the patient. If the patient feels breathless, then I give you oxygen. I will right now I am making the planning. In planning, what we do, only plan what we have to do in implementation. Planning involves the decision making and problem solving. It is the process of formulating the client goal and designing the nursing interventions required to prevent and reduce the elimination the client health problem. So in what we do in this, we only make the goals and what intervention we have to take. We make the planning. There are three types of planning: initial planning, ongoing planning, and discharge planning. Next one is the nursing intervention. That is a very important, but which we have to do actually. Nursing intervention is any treatment that a nurse performs to improve the patient's health. Implementation consists of doing and documenting the activities. For example, in planning, my patient said that I have a I feel breathlessness. Uh, I plan that I will check the uh, uh, saturation of the patient, then give the comfortable position to the patient. After that, I give the oxygen to the patient. I do the planning. In implementation, I implement all the things. Next one is the evaluation. Evaluation is a planned, ongoing, purposeful activity in which the nurse determine uh, can we achieve that goal or not. Implementation, the effectiveness of the nursing care plan. What we do in evaluation, we check the effectiveness with the nursing care which we give is effective or not. We have to be reevaluate that. For example, if your goal was patient will report pain less than 3 out of 10 within a 1 hour of receiving the analgesic, and the patient still report pain 7 out of 10, you will reevaluate was the dose was low, was the drug is effective, or is there is any complication like internal bleeding. In which process we check in the evaluation. Okay. So what we discuss till now, we will discuss about the nursing process. Nursing process is the nursing process is the systematically is the process is the critically thinking and systematic method of providing the care to the patient. This is what we do in there have a follow in this the ADP. ADP means assessment, diagnosis, planning, implementation, and evaluation. Why we follow this process? Because we cannot if we have to provide a good effective care, so we have to follow this step by step to minimize the any to minimize the any uh, problems, to minimize the to provide effective care, so that we follow the steps. In assessment, what we will do, we will collect the data. We collect the data like the two forms, subjective data and objective data. Okay, subjective data I already told you. We have to be first of all assess the condition of the patient. Without assessing, we cannot implement anything to the patient. There are a lot of method of data collection, for example, observation and interview, direct interview, or indirect interview. In diagnosis, what is the difference between the nursing diagnosis and doctor and medical diagnosis? Medical diagnosis, nursing diagnosis is the actual diagnosis which we feel the what the patient feels, and nursing diagnosis is the actual condition of the patient. Planning, in this what we do in planning, what we do, we make a nursing goals which we want to achieve to reduce the reduce or eliminate the health problem in the patient. Implementation, which planning we have to be implementing all that. I think evaluation, in evaluation is the we check is our nursing care is effective or not, so we evaluate. Okay, so evaluation is the planned and ongoing purposeful activity. I think we cover um, all the steps of the nursing process. And the main tip in NCLEX, always assess before you intervene unless ABC are compromised. Nursing diagnosis focus on the response, not on the medical diagnosis. Next, a hierarchy and ABC I will give the priority. We always check the safety of the patient. Moreover, we also follow the ABC. Evaluation is not an option, it is the only the way to know the care was effective or not. So we have to be always check before doing anything. Now we will discuss on one or two questions on that topic so that we know that will we understand this topic or not. For example, my first question is: a nurse enter the room of a patient who reports chest discomfort. What should the nurse do first? First one, ask the patient to rate the pain on a scale of 0 to 10, obtain a full set of vital signs, administer prescribed antidote, and document the patient complaint in the chart. So, according to that, my answer is B. Check the vital signs of the patient. Because why so? Because that chest discomfort is the subjective data. That is that is given by the patient. In this no airway ABC is compromised. So first of all, we assessment what we have to assess the vital signs of the patient. Okay. Next question is The nurse is caring for a post-operative patient who report pain. Which step of the nursing process in the nursing performing when administering prescribed morphine? So, a patient is a post-operative who uh, report pain, and we have to be administer the morphine. That is the implementation, because in implementation we administer the medication to the patient, we administer what according to the condition of the patient. So these are the questions according to the nursing process what we discuss in this lecture. I think I discussed all the topic, and I think it will be understandable also. Thank you so much.